Hello, hello, hello. Hello, all. Good evening. I am Teresa McCalman. I am currently running to be New York State Senator in the 49th Senate District here in upstate New York. And this is the second town hall type live stream that the campaign is doing, just to get us all updated on what's going on in the world in regards to COVID-19. I'm looking off onto the other side of the screen, or I should say off screen, because I have some notes and I want to make sure that I stay on point and give as much information as possible. Let me see. We've got a couple of people on. Just want to make sure. If you have any questions, you can post them to the live stream. Unfortunately, if you are hosting a watch party during the live stream, which many people did the other day when we had, yesterday when we had tea with Teresa, I cannot see the questions or comments that you post to the hosted party. So, and I'll repeat this again as more people jump on, but if you want to ask me a question, you need to go directly to my Facebook page and join the live stream there. But if someone is hosting a watch party, only that host can see the questions and comments in that stream. I had gone back after tea with Teresa yesterday, and I had seen, even my daughter said she was on watching, but I told her I didn't see her in any of the comments or didn't see her wave, because I think it was Patrick Nelson was hosting a watch party for my tea with Teresa, excuse me, and she was on his watch party, so only he could see the questions and comments. So if you're going to share the post or host a watch party, please let the people who are joining you know that I can't see their questions or comments. They have to go to my page to actually, ask the questions in order for me to see it here in the stream. Okay. All right. Again, hello, everyone. My name is Teresa McCalman. I am running to be your senator in New York State 49th Senate District. And this is our second town hall. And I just want to go over quickly some of the things that the governor said today. I'm going to highlight probably like two things, and then we can talk about anything else that he said that was, pressing. So he reiterates often that about 80% of the population will be infected with this virus. And he also said approximately 40 to 80%, and about 80% of the cases are naturally resolved, which means you build up that natural immunity or antibody, and eventually you get better. About 15% of those cases, however, 50% of the people who do get sick, those cases require hospitalization, and he's reiterating this over and over again if you didn't hear that already. I want to talk about his projections for hospital beds. So he says that we need 140,000 beds. And he said all hospitals need to increase their capacity by 50%. That means they need 27,000 plus additional beds. Some hospitals need to increase their capacity by 100%. So that's more than 5,000, which would be about 85,000. FEMA and ACE, Jacob Javits Center, Westchester Center, Stony Brook, and Old Westbury, these were acquired by the FEMA, and that's increased our bed capacity by 4,000, which means a total 89,000. And then some dormitories downstate, not upstate New York, but downstate, we could increase that capacity by 29,000 plus, and hotels and nursing homes. We have no numbers for those as of yet, but I just wanted to throw those things out at you. Numbers make people very comfortable. We have 4,000 ventilators, and I know the governor expressed that 4,000 was not enough. They purchased 7,000 additional ones, but they need a total of 30,000 altogether. So 40,000 people have signed up to be enrolled in this surge healthcare. This is something that I want to highlight because our first town hall this Monday was right after the governor had mentioned earlier in the day, Monday, that he was imploring people to medical professionals to come out and actually volunteer. I don't think he said volunteer, but help with the surge in beds. Formerly working in nursing, I understand the capacity, the ratio between healthcare provider and patient, and the imbalance it is all the time. It's very strenuous work on nurses and doctors, CNAs, LPNs, everyone in the nursing profession when we don't have enough staff. And I wanted to point out that I reiterated Monday what the governor had said, that he was just asking retired nurses and other healthcare professionals to please temporarily come out of retirement and, jump on and help out. He said it was not an executive order, but he was just asking. And then Monday night, I said, I thought this was an awesome idea. And because I live in Schenectady, and because of that, we have a large population that depends on two hospitals or healthcare facilities, 3, if you count Bellevue, for employment. And since 2008, a lot of that employment has been slashed, horribly slashed. And we were actually, St. Clair's used to be one of the hospitals. And when that closed, a lot of nurses lost their jobs. We have a lot of people who lost their pensions, and that's a whole big mess, and that's for another day. I'm hoping to help out nurses with that soon. Also, hi, Samantha. Also, I said it would be a great idea if our St. Clair retired nurses, or those who were just recently laid off from the medical surgical center, if they could just come back and please help out at Ellis Hospital. So far, I want to tell you that 40,000 people have signed up, right? So I'm not saying I had anything to do with this, but I just reiterated what the governor said and was very specific to our district in regards to the nurses that were retired or forced to retire or laid off during this whole St. Clair's debacle since 2008. So I just said this would be a great opportunity for us to get in. In February, I froze my fingers and toes and other important parts off, protesting with my fellow nurses about safe staffing. I cannot say how important it is right now. It was just as important then, but now during this health pandemic, it is extremely important that we have a patient-nurse or medical staff ratio that is safe for nurses, medical professionals, all around, and of course, most importantly, our patients. Safe staffing means safe patients, healthy patients. Hi, Deshawn. How you doing? Hi, Adam. How are you? This is very, very, very extremely important. If anyone has questions, if you want me to repeat anything, just post a question and I'll try to keep up with the stream of questions coming in. So it's very extremely important that we have a healthy balance of staffing. Now, I want to give a breakdown of those medical professionals because I am impressed. I actually wrote a little thing, but then looked at some of the notes that my team had made, and we pretty much made the same thing. I want to say that we have 2,265 physicians. This is out of the 40,000 that have volunteered with the surge healthcare force. 2,409 nurse practitioners, 938 physician's assistants, 328 nurse anesthetists, say that 3 times fast, 160 respiratory therapists, which we probably need a lot more of those, especially that this is a pulmonary virus, 16,367 RNs, 4,016 LPNs, and these workers, I want to make this clear and reiterate what the governor said earlier. These workers are not yet deployed. These are people that heard the call from the governor and said yes. I'm hoping that some of you who watched our first town hall on Monday heard me ask our St. Clair's retirees and anyone, even if you did not retire or were forced to retire at St. Clair's, anyone else who's a nurse, a former nurse, or a former physician's assistant, any medical professional, we need everyone, all hands on deck. If you heard me Monday, I'm really hoping that those of us who know medical professionals who are retired, that you shared that information and that you're part of these numbers. And to say again, out of the 40,000, all these 40,000 people that have signed up for the surge healthcare force, they're not deployed just yet because they're waiting for those hospital beds to be created. Because right now, as it stands, we still need that bed capacity to increase because our numbers are going up. And I'm going to talk about why our numbers are going up in a moment. It's just natural, with testing and everything else and where we are in regards to tourism and all that, those things like that. But it says they will be deployed when hospitals need reprieve. So our current medical staff that has been dealing with the coronavirus, COVID-19, I should say, all this time, can you imagine? I mean, if you've never worked overnight shift or mandatory overtime and any medical professional, can you imagine the hours that they're working right now? The shifts, they're probably not even going home. They're probably sleeping in some empty room. There's no empty rooms. Probably sleeping in the hallway or closet or somewhere, taking any moment's rest that they can get before they go back and help with the surge of patients that are coming in respiratory distress because of COVID-19 and other serious cases along with that. Understand that we are not just dealing with COVID-19 patients, we're dealing with everyday patients as well. So we have to keep that in mind as well. So these people, this 40,000 people who have volunteered, they're needed for that reprieve as well. I also want to point out, today, we posted, I think it was yesterday and today, we posted a couple of hotline numbers, and two of the things that I said was extremely important I wanted to get out there. One, today is National Epilepsy Day, and I'm going to get back to that in a moment. And the other thing is the mental health hotline. The governor stated that we have 6,175 mental health professionals, or over 6,000, easier said, who have signed up to treat people for the free hotline. And that number is 1-844-863-9314. And we're going to post that again, so don't worry if you're not getting the number and I don't repeat it, but I just want to stress that we need more mental health professionals as well helping out we need therapists, psychotherapists, psychiatrists, everyone to help. This is stressful for everyone. And if you don't think you need a therapist during this time, you need a therapist, especially if you do not think you need one or to speak to someone. You do. Everyone at this time needs someone to talk to let loose in this time of lockdown and forced quarantine, needed quarantine. Also, what did he say? We do not have time Our hospitalization apex will be in 21 days. He talked to the president about rolling deployment. Thank you. My daughter just delivered me some tea. As soon as we get past our critical moment, we will send equipment and personnel to the next hot spot. A lot of this stuff, this information, you can look up. I just wanted to point out the medical professionals, including the mental health professionals who have volunteered. That's over 46,000 people who have volunteered their services during this time. Thank you so much. Hi, Juan. Hi, Mikhail. How are you? Also, one other thing I wanted to talk about is this $2 trillion coronavirus bill. Everyone's supposed to be getting a check in the mail. Now, I went back and forth on my feelings of this, and I've heard so many different things about what was going to be done, what it was going to be based off of, 2018 taxes, 2019. I don't know about you, but my economic situation has changed dramatically from 2018 to 2020, and a lot of people were upset about that. The amount was not very friendly to those of us who earn less than, who earn less than, I was going to say a certain amount, but the less money you earn, the less money you were getting, which made absolutely no sense. And big businesses, again, were receiving these bailouts. So I wasn't happy with that. Now, the Democrats in Congress came back and kind of went back at the Republicans with their own package. And I put my hand to my forehead, and I've been doing this for this entire campaign, and then this happens. But and I said, great, this is all going to be about politics instead of about the people. They're going to go back and forth saying, well, it's the Dems' fault, well, it's the Republicans' fault. But they seem to have come to an agreement where if you filed your taxes in 2019, then your stimulus check would be based off your taxes for 2019. If you did not file yet in 2019, they would be basing it off of 2018. So I guess some of us who did not file our taxes yet, that may be a worry for some of us, or it may not be. But my thing is this. I'm happy that a lot of us are receiving this stimulus check, especially those who have children. The extra $500 on top of the $1,200 per child is going to be a big help. And there are different ways that they're going to make sure that you can receive this, whether it's electronically, through a check. Make sure your home address has been updated, because they're going to go by whatever's on file. So make sure you update that immediately. And my team will find the links that and we'll post that information so you know exactly who you need to speak to update that information. But in the end, the cities that were asking for help, including New York State, did not get the support that they needed federally to fight this virus. And unfortunately, I was more focused on the people on the ground, right? I wasn't thinking about the state just yet as a whole. I figured something had to be in there, but I want to make sure that everybody was getting what is needed to keep them afloat while we're all laid off. And then the governor pointed out, no, this is a terrible bill for New York. It says New York State gets $3.8 billion, right? And we're looking at a revenue shortfall of $9 billion. So 9, 10, 15 billion. And New York City gets $1.3 billion. And the House bill, New York State got $17 billion. In the Senate, we got $3.8 billion. So that's 103,000 total tests. Oh, excuse me. What am I talking about? So that's a big revenue shortfall. And the governor's not happy with that. Let me tell you, I wish I was your elected official right now, because I really would like to sit down with my colleagues and try to figure out what exactly is going on and what we can do, because our budget is due April 1st. April 1st. And I'd really like to see what magical cartwheels they're going to do to keep us from crashing completely economically. These stimulus checks are great for us to get food, maybe pay a little portion of our rent, and keep us afloat for a few weeks. Maybe not even that, but the state as a whole still needs to function. Our government still needs to function. We need that revenue to stay alive, essentially. And I'm glad he pointed that out. It's going to be tough. So I just wanted to point that out. There's some. I don't really want to focus too much on the tests, because it could be a little bit anxiety and heightening. But there was a question that the governor asked himself that many people have asked. Why do we have 10 to 15 times more positive cases than the next highest states? And he said, because we welcome people from across the globe. And the virus was here much earlier than we know. And so people travel all over the world. And I hear him, and I get that. New York is a melting pot. People come and go from all over the world. That's understandable. But I think I may slightly disagree. I think his next point in the fact that we live in New York City closer together, as a historian and understanding these things sociologically, when you start to settle and make civilizations, you increase the chance of disease, period. The more concentrated and dense the population gets, the more chance you have for disease, especially when you start domesticating animals. These things tend to appear, and these things do tend to happen. So I tend to agree more with the fact that because New York City is such a dense population, that's why we have a higher rate. And it's I mean, that's just fact right there. You can't dispute that at all. Let me see. Let me see if there are any questions. This is a town hall. I don't want to just keep talking. If you have any questions, again, if you are hosting a watch party for this video, I cannot see the comments or questions during your watch party. I can only see it if people are here watching it from our actual live stream. So please let those in your watch party know that I'm not responding because I can't see the questions because I'm not a part of that watch party. Let me see. Someone said something. Yes. So free emotional support consultation, the number is up there if you missed it. If you're more comfortable texting, there's a text line. Yes. Hi, Sean. How are you? Sean was one of our volunteers during the campaign petitioning time, and he is also a member of Citizens Action. Hello, Sean. So do you have any questions, not you, Sean, anyone, have any questions about anything that I said in regards to the bed capacity needed, our surge healthcare force? There's a couple of things I just want to mention. One, nope, no one's asking a question. One, I want to say thank you to all of our nurses, doctors, CNAs, PCAs, LPNs, NPs, anesthesiologists, everyone, every medical professional out of those 46,000+ people who have volunteered their time during this health crisis. Thank you so much. I really, really appreciate you, and I know all of us really do appreciate you. I want to point out, I know last time I talked about some businesses or famous people or celebrities that are helping out during this crisis, and I want to point out James Dyson. He owns the Dyson company, you know, the vacuums, and he just created, in 10 days, he invented or built new ventilators. And I think the EU is asking him, or Britain is asking him to build 15,000 for their needs. And I think that's awesome. So he turned from manufacturing vacuums to manufacturing ventilators, and he did this in 10 days. Thank you so much to James Dyson. And I really, if you know of anyone else who has, anyone like James Dyson, the millionaire, if you know anyone who has done the things that he is doing and other celebrities, please let me know. How can people get involved in a campaign as it converts to a virtual campaign over the next few months? How can you get involved? Well, we need people to do calls. We need support. We are still running a campaign, and all campaigns need money. And because we have gone virtual, understand that not everyone has access to internet. We know this. So people have a right to know who we are, who I am, why I'm running, and choose whether or not they want me to be their representative in the 49th district, Senate district. And that means that we need to send out mailers. We need to send out information. And in order to do that, we need to purchase these flyers, mailers, postcards, everything with information on it for those who cannot see us or contact us through email or electronically in any way, shape, or form. We need to send out paper stuff. So any donations that you can give to us, I think the link is up there. Can't donate? No problem. Help fuel our campaign by making donations. Yes, please. If you're unable to get on the phone and make some calls, right now we're doing health check-ins. We're not necessarily calling for money, but we're just checking in on our people in the district and calling and making sure they're okay. If you can't help out with that, if you can send some postcards out, that would be great. If you can donate $2, $5, sponsor a few mailers with $10, $2, $5, $10, $20, as much as you can during this time. I know money is tight. I know, I see my bank account, but we really need to make sure that our democracy and our right to choose our representative still exists. That has not been taken away from us, and it probably never will. So I want to make sure that everyone knows that they have a choice. Any other questions? Let me see. So teresaforsenate.com, teresaforsenate.com, or teresa@gmail.com if you have any questions. If you want to get in touch with anyone on my campaign and you want to know how to help, please feel free to connect with us. My ActBlue link is up right now in the comments. You can click on that and you can donate anything, please. Any little bit helps. It would be very important to make sure that we're reaching all our elderly folk out in the boondocks, where that internet is not available, where they do not have access to Spectrum or Verizon or high-speed internet at all, or they're still using antiquated things like flip phones, and they are not able to access Facebook, Instagram, or Twitter. Please help us reach those people. teresaforsenate.com. How can people... All right. I think if there aren't any more questions, I am not going to stay on any longer. If you want to reach out to me again, teresaforsenate@gmail.com, teresaforsenate@gmail.com, or teresaforsenate.com. All right. Thank you, everyone, and see you later. Drink tea and be healthy.